Austin Weston, the Center for Cosmetic Surgery, is proud to present the new You Now podcast, today featuring one of the founders, Dr. George Weston. And now, here's your host, Rebecca Bennett, and Dr. Weston.
Wasn't like that when I grew up. No one wanted a big butt. When I grew up, it was, the most famous model was Twiggy, and she was as thin as a rail,
Tiny. So we've talked about tummy tucks a couple times, a couple other episodes, but this one we wanted to get a little bit more specific.
Okay.
And talk about tummy tucks in certain situations, starting with prepping for swimsuit season, especially since a lot of us have been quarantining at home, hanging out, eating chips on the couch, and now we got to think about getting in a bikini. When is a good time to start thinking about that? How far out from the warm months should we be thinking?
First of all, you might not need a tummy tuck. It might only be some liposuction or even a little weight loss might do it for you. And so you should come in for a consultation, and since every procedure is custom designed, we'll look at you and your anatomy and see what the best procedure is for you. And so most surgeries, their best results after surgery are somewhere probably at least 3 months, because there's some swelling that goes with it. Tummy tucks are no different. We don't take post-operative photographs for 3 months because you get better. A tummy tuck has a very low, or it should be a very low scar that's hidden in the bikini line. That scar generally is pink and noticeable for 6 months before it starts to fade. And then it might take it 6 more months to fade. You'll look good before it totally fades, but the scar generally will not look good for 6 months or a year.
Is liposuction the same 3 months, you would say 3 months out?
I would say 3 months, just for your best result. You probably will see a result immediately. Like the next day, you'll see that you're thinner, but it swells a little bit, and so it's not your final result. And so generally, I don't want people critiquing their result at a week, because they're swollen and irregular, and it gets firm and lumpy, and then it gets soft and smooths out. But that takes, probably at least 3 months.
Do you tend to opt towards liposuction or a tummy tuck more often?
I think it depends on your anatomy. When you look at an abdomen to decide what operation to do, if it's a young person with tight skin and tight muscle, then you can just liposuction it because it'll snap right back. And so there are 3 things involved. There's the subcutaneous fat, say, that you can pinch. If you can pinch it, it can be suctioned. If you can't pinch it, it's inside around your organs, and we can't get to it. That's intra-abdominal fat. And so there's the fat that you have, and then there's how loose your muscles are, which after pregnancy stretch out some and can need tightened. And then there's the loose skin. And so if you just have a little bit of fat and your muscles and your skin are fine, then it's liposuction. If you have loose muscle or loose skin, then it's probably liposuction plus a tummy tuck.
I really love the fact that the first part of your answer was to maybe try exercising or losing weight first. Are some of your potential patients kind of surprised at how much they can get rid of just by maybe focusing on exercising in their abdomen area?
I think that most people think that exercise can do more than what it can do. When we exercise, what we do is we strengthen muscle. But the skin and the fat are passive, and you can't tighten a spot by spot exercising. You strengthen muscle. And after pregnancy, if your muscles have spread, you can never get those back by exercising. You can strengthen them, but if there's a space or a gap between your muscles where the baby has stretched it out, you can't get that back. And so the trainers that we go to might say, sure, you can make that better with exercise. It's physiologically impossible. And so there's a limit to what you can do with exercise. And also, you can't burn the fat from your abdomen, say, by doing sit-ups. The body doesn't work that way. It burns calories. and the calories, come off where they come off, and it's probably genetically determined where you're going to gain or lose your weight. You can't make it come off of your abdomen by exercising your abdomen. It just doesn't work that way.
And after surgery, how long do you have to wait until you can exercise again?
It depends on what procedure you have done. Generally, it takes at least 2 or 3 weeks for Mother Nature to glue it together a little bit so that you can get back to normal activity. But after a tummy tuck, when we tighten your muscles with sutures, I generally don't want my patients doing things like sit-ups for at least a couple of months. The scar tissue that holds you together will actually get stronger for at least 3 months.
Gotcha. And does the tummy tuck or liposuction get rid of stretch marks?
If the stretch marks are below your belly button and can just be excised, yes, you can get rid of them. However, we don't have a good procedure for improving stretch marks unless we totally excise them. Lasers won't get rid of them. It's just something that technology has not yet figured out.
And say a woman wants to get a tummy tuck, maybe to try and get rid of the stretch marks, but then also decides to get pregnant after. Would you recommend that a woman get pregnant after she has a tummy tuck procedure?
It's not the ideal thing to do. I understand that people do that. We have a nurse, for instance, that had a tummy tuck and then got pregnant shortly afterwards. It won't harm the baby. It will just harm your cosmetic result. And so I would generally recommend that you have your children and then have a tummy tuck because you don't want to stretch it out again.
Can you go back and get a second tummy tuck after?
You can. I have done second tummy tucks on a few patients in my career. It's not common. Generally, one tummy tuck is all you're going to need. Now, if you gain a lot of weight and then lose a lot of weight, or you get pregnant and have another child, certainly you can ruin your result. I think the biggest thing that ruins your result is if you gain weight afterwards. Ideally, you want to stay at a stable weight afterwards and not gain and lose a lot of weight. But I've never seen anyone ruin a result by losing weight afterwards. And so patients come in and they say, well, I'd like to lose 20 pounds. Should I do that before my surgery? And I generally don't think that's a good idea because the most common thing that happens with people who diet and then have surgery is they gain weight back. And if you have your surgery and you gain weight afterwards, you will ruin your result. If you have your surgery and lose weight afterwards, you will not ruin your result. And so, maybe I'm a contrarian in that view. I don't necessarily want you to be at your ideal weight afterwards because what I'm afraid of is you'll, gain weight afterwards and ruin your result.
How much do good health, like exercise and a good diet, and plastic surgery run hand in hand?
Oh, I think that patients that are in good physical condition and who are not fat, they recover faster, they get a better result. It's easier for the surgeon to do the surgery and get you an excellent result. People who are overweight, have high BMIs, are more likely to have a complication, and they're less likely to get a good result, and their recovery period will be longer. So yes, be thin and in shape for any surgery,
Right.
For any kind of surgery that makes sense.
Would there be any sort of outlying factor that would make someone maybe not a great patient or a great contender for a tummy tuck surgery or even liposuction?
Yes, patients who are obese have more complications. The circulation to the skin is not as good, and they're more likely to have a complication healing it. If you've had previous abdominal surgery with scars, say an old-style gallbladder operation with an incision up in the right upper quadrant can affect the circulation to the skin. Those kind of things can do that. Anything that can affect healing. Diabetes is a risk. Smoking is a risk. Being overweight is a risk. all those things. And we take those things into consideration when we design the surgery. We want it to be safe, and we want you to get a great result, and we don't want to risk a big complication.
Do you find that I guess, how often are you also operating on men and doing tummy tucks and liposuction on men?
Not very many men come in for tummy tucks. Mostly it's men who have been heavy and lost a lot of weight. Tummy tucks are more commonly, the reason is because of previous pregnancies.
Because there's just a lot of buildup of skin in that area?
Yes, what happens is babies stretch out your abdomen. They stretch out your muscles that need repairing. Men generally, don't do that. So men have more liposuction and fewer tummy tucks.
So tummy tucks, you would say, are more of a, less of like a weight loss type surgery and more of a post-pregnancy surgery?
I would not consider tummy tucks or even liposuction a weight loss procedure. It's a contouring operation. It will look like you lost a lot of weight, but you won't lose much weight with a tummy tuck. Maybe 5 or 10 pounds at most if you're thick. But most people are not, and so you might lose a couple of pounds, but it might look like you lost 20.
And I know in a couple other like liposuction surgery, sometimes you're removing fat from one place and putting it in another part of the body. Mm-hmm. Does that also tend to be a common combo in these surgeries?
Yes, we're doing more actually. They call it a Brazilian butt lift, a BBL, where we do liposuction of your abdomen and flanks or back, and then we filter it and we put it in your butt to make you a better contoured gluteal region. And so that's becoming more popular. It wasn't like that when I grew up. No one wanted a big butt when I grew up. It was, the most famous model was Twiggy, and she was as thin as a rail.
Tiny. Mm-hmm. Are you personally doing more Brazilian butt lifts?
Yes, I think we all are. Yeah. The whole practice is. Mm-hmm. Yep.
And I think there are a lot of misconceptions out there about the dangers of the Brazilian butt lift.
Well, I think that as far as the possibility of significant complications, for a while it was certainly one of the riskiest operations. I think now that we've gotten better at it and we've made it safer, it's a much safer operation than it used to be, because we discovered that we needed to put the fat more superficially rather than in the muscle. If you put it in the muscle, there are large blood vessels in the muscle, and you don't want to inject fat into a blood vessel. And so now we do it more superficially, and it's a safer operation.
All right. Well, thank you so much.
You're welcome.
Hey guys, thanks for tuning in to this episode of Austin Weston's New You Now podcast. If you liked what you saw or heard on today's episode, please like and subscribe to our channel. And if you have any questions about any of the topics we've covered today or in past episodes, send us an email at hello@austin-weston.com or just leave us a comment below. See you next time.
For more information, visit austin-weston.com or call our offices for a consultation, 703-893-6168. And make sure to subscribe to our podcast series, Austin Weston, the Center for Cosmetic Surgery.